Hi everybody, this is Mallory Grimste, teen therapist from Woodbridge, Connecticut, and today I just wanted to tell you a little bit about how to start therapy. It can be really scary when you're thinking about picking up the phone and calling a therapist for the first time, so I just wanted to tell you what to expect all the way from that first phone call to your first meeting. And again, this is just my way of working. This doesn't mean that every therapist works this way, though I've tried a few different techniques and I found that this format works best for my clients and the way that I work. So basically the call. Some therapists will be totally cool with setting up the first intake assessment just before even talking via email. I am not. I don't find that helpful because I feel that you can get a lot from somebody like voice to voice. I'm much more of a face-to-face kind of person, obviously. I am a therapist. But I found that sometimes in email, people can come across one way when their intention is to come across a different way. And so it's really easy to mix messages and misunderstand what's being said, and in a phone conversation you can clear that up right away by asking a follow-up question like, oh, did you mean this? Or so what I'm hearing is you said A, B, and C. Is that true? And you can say, no, I meant D, E, F, or like, yeah, that's right on. And we can keep it moving, and it's really just a few minutes. I try to keep my phone screenings to about 15 minutes. I find just getting like a few key pieces of information and then talking about what that next appointment is really all I need to feel that I'm ready for that next step with you. So then let's talk about the first meeting. So I work with a lot of teenagers, and teenagers in general, a lot of them are not feeling in control of their lives, and so they try to grasp control anywhere they can. And one of the ways that they try to get that control is by wanting to only talk to the therapist and not have their parents involved, which may work for some people. I find that when you're a teenager, your family, it's beneficial to have your parents involved to some extent, whereas, the actual therapy is yours and yours alone, and nothing can change that. Though you are still living with your parents and they do have a lot of say and control over what happens in your life, and so having everybody on the same page from the beginning is really important. So at my initial assessment, I do ask that at least one of the parents, if not all of the parents that are involved, attend the meeting with the child or the teenager, so that I can just introduce myself. You guys can put a name or a face to the name and the voice. And then we can move from there, and I go over, practice policies and procedures so the teen is aware, the parents are aware, there's no confusion about that. And then the majority of that first session really is with the teenager, because I want to get their perspective on what's going on, what's happening in their lives that they're feeling they're struggling with, what do they feel that they can work on, what do they want to focus on, because the reality is I could have all sorts of ideas about what would be best for them. Their parents could have all sorts of ideas about what would be best for them. Their teachers could have all these ideas. But really, that teenager is the one living their lives. And so they need to be working on what they feel they need to be working on. And if there's something a little more pressing or urgent, of course, we'll encourage that. But most of the time, I found that my teenagers know what they need to, get rocking and rolling on. And then I call the parents back in. We swap out. I meet with them individually while the teen waits, and I just get their perspective a little bit more. Sometimes I do a little fact checking, a little family history. And if everybody's feeling good and ready for that next step, we make another appointment at that point for what's called our treatment planning session, where we all meet together and I type on my computer as we go along, so I can just print it out and you guys can have a copy right away about what specifically are we going to work on in these next 3 months to get you to where you want to and need to be done with therapy. And I do that with the family about once a quarter, so about every 3 months. It's not like set in stone, it needs to be every 3 months. If something pops up sooner, we can meet sooner. If it's schedule doesn't work out, 2 or 3 weeks isn't going to make or break us necessarily. But knowing that check-in is coming up and that, it can change at any point, I find super, super helpful. And that is in the teenagers and the parents' words. That's not my wording, so it's their goals that they want to work on. And then it's my job to figure out how I can best use my therapy training and counseling skills in the sessions to help them get there. And that is how you get situated with therapy. So if you have any questions or anything, feel free to shoot me a message. I love getting messages. I love connecting with people. So, I'll definitely be replying. And if I can help, I'll help. If not, I'll try my best to direct you to where you can get that help. All right, have a great day. Thank you.